Hi, everyone. My name is Jarrell Daniels. I'm considered to be an activist, an educator, and even a peer mentor. But I'm also someone who served a 6-year sentence in state prison for a crime I seriously regret. I can't imagine what you're going through right now, but I can imagine what it's like to have my freedom taken away from me. I can't imagine what it's like to be in a facility facing a virus and ultimately wanting to be free and home with your loved ones. What we're going to ask you to do in this video is just to listen and hopefully take some of the tools and suggestions that we're offering. I want to pass it over to my colleague, Dr. Elizabeth Burnett from California, who provides healthcare to people who are living in places like you. She's going to tell you a little bit more about what you need to know about the virus, and then I will return at the end to offer some words. Thank you.
My name is Liz Barnard. I'm a pediatrician at UCLA. This presentation was developed by Amend. It's a group at the University of California, San Francisco that works to make the justice system more fair and healthy. It is led by experts in medicine and public health. Today we will talk about how someone can get COVID-19, what happens to your body if you get COVID-19, and how you can protect yourself from COVID-19. So, how can somebody get COVID-19? COVID-19 is caused by a virus, sometimes referred to as novel coronavirus, and it spreads when tiny drops from a sick person, like spit or snot from somebody's nose, get into another person's mouth, nose, or eyes. This can happen when you are near a sick person, generally when you are within 6 feet of them, and that person then coughs or sneezes into the air. You can also get COVID-19 if you touch something like a door handle with a tiny droplet on it and then touch your mouth, nostril, or eyes. So this is a picture of droplet sprays that happen when somebody coughs. This also happens when somebody sneezes, and the virus can travel in these tiny droplets. What happens if you get exposed to COVID-19 virus? Many teenagers who have the virus in their body will not feel sick, but can still spread the virus to other people. If you do get the virus in your body and you do get sick, it usually takes about 5 days to start developing symptoms. During that time, before you even realize you're sick, you can spread the virus to other people. Can teenagers get very sick from COVID-19? Yes, sometimes, but it's rare. In general, teenagers tend to do okay when they get the virus. People with highest risk of getting very sick from the COVID-19 include older adults, people over 60 years old, and people of all ages, including teenagers, who have some medical problems, including asthma, heart disease, obesity, and history of smoking. What happens to your body if you get COVID-19? So most commonly, most people will develop fever. 75% of people with the virus, or 3 out of 4, will develop a fever. 50% will have a cough, that's half of people. Muscle aches will be present in 25%, or 1 of 4. Sore throat, 1 of 4 people. And headache, 1 of 4 people who have the virus will have that symptom. 1 in 10 people, or 10%, will have difficulty breathing. 1 in 10 will have a runny nose. And 1 in 10 teenagers with the virus will feel sick to their stomach or will throw up. How sick do most people get from COVID-19? Most people, including people of all ages, don't get very sick from COVID-19. Among people of all ages, including adults, 1 out of 10 people with COVID-19 will have to go to the hospital. And 1 out of 20 people of all ages with COVID-19 will have to go into an ICU or intensive care unit at a hospital and use a ventilator or a breathing machine, also called life support. What do doctors do to treat COVID-19? There is no cure at this time for COVID-19. Doctors can help support people with COVID-19 with 4 methods: supplemental oxygen, acetaminophen or Tylenol, IV fluids, and inhalers. Scientists right now are working on making a vaccine and a cure. How can you protect yourself from COVID-19? So remember this picture of the droplet spray from a cough or a sneeze. What can you do? First, it is important that you practice physical distancing, also sometimes called social distancing. meaning staying at least 6 feet away from other people. Second, wash your hands as many times a day as possible with soap and water. Third, use hand sanitizer. Fourth, if you don't have access to washing your hands. Fourth, don't touch your face and wear a mask. These are the most important things that anyone can do to prevent COVID-19. What is physical distancing? Physical distancing is staying 6 feet away, which is usually 2 arms length away from other people at all times. That includes when you're walking down the hall, using the bathroom, talking to friends, playing games, exercising outside at all times. In some states, the law says people must use physical distancing, including right now in California, where I am. It is important to practice physical distancing and frequent hand washing because it makes it very difficult for the virus to spread. When you wash your hands with soap, you kill the virus. This is a picture of adults practicing physical distancing. You can see that they're all at least 6 feet apart. Here's another picture of people waiting in a line practicing physical distancing. How can you use physical distancing while locked up? Don't shake hands, fist bump, or be close enough to touch if you don't have to. Try to limit the number of people who you are close to. If you're allowed, sleep head to foot with your bunk or cellmate. Don't touch things that are used by lots of people, like weights, basketballs, or playing cards. And keep areas and things that are used by many people clean, like day room or dining table, shower knobs, and sink handles. What can you do to lower your chance of getting COVID-19? Anyone who is feeling sick should get medical care. If you do feel sick, don't panic, but please do tell staff, a nurse, or a doctor. If you think that someone is sick, you can encourage them to tell staff, a nurse, or a doctor. And remember to practice physical distancing, meaning staying 6 feet apart, wear a mask, and wash your hands as many times a day as you can. What is medical isolation? Is it normal to put someone into isolation if they have COVID-19 symptoms? If you have been around someone who has the COVID-19 virus, you may need to be separated from others until a certain number of days have passed to see if you get sick, and you may also get tested for COVID-19. If medical staff test you for COVID-19, they won't be able to tell you the results right away. It may take a few days to get the results. And it is important to understand that quarantine or medical isolation are not the same as room confinement or isolation as punishment. You are not in trouble if you are exposed to COVID-19 or if you get COVID-19. Someone in medical isolation should still get as many regular privileges as possible, like exercise, books, and activities. So remember, most teens who do get COVID-19 do well. If you wash hands, wear a mask, and practice physical distancing, you are likely to be safe. Thank you.
I want to pause for a moment. I want to be really honest and meaningful. I can't imagine how you're feeling right now, what's going through your mind as you're looking at the screen. I can imagine the conditions that you may be facing in the facility that you're confined in. But what I do want to tell you is that there are some people on the outside who are doing everything in their power to improve the conditions within facilities. I'm here to really talk to you about the COVID-19 crisis that has been drastically impacting millions of lives of people across the world. I know that this is a very challenging time for us to all be living through, but I want to be meaningful in the message that I give to you. But I think that what we can do right now, even under these conditions, is to practice the most safe and effective ways to reduce our contact with the COVID-19 virus. Physical distancing means you keep 6 feet away from people as much time as you can throughout the day. Now, as someone who served 6 years in prison, I can honestly understand how hard it may be to keep physical contact limited. But I also want to encourage you to just be mindful, be aware, and be attentive to what's happening around you. If you see a large crowd, do whatever you can to try to avoid it, to walk around it, or to just hold off on even going in that direction if you can. I know that there's some things that you just have to be in crowds, like when you're walking inside of the cafeteria, when you're going outside to the recreational area. But I encourage you, please just do whatever you can. And if we're feeling anything, if we feel sick, or we have any symptoms that resemble what is called the flu, If you're feeling nauseous, if you're having any body aches or pains, I encourage you to please reach out to an adult. Washing your hands as much as you can with soap and water for at least 20 to 30 seconds. We recommend these things just to reduce the amount of bacteria that you may accumulate over time as you're touching doors, as you may, touch other surfaces, as you may fist bump when anyone shakes someone's hand. These are the kind of things you want to prevent yourself from doing. And I know that you might have saw people wearing face coverings, people wearing masks. These are some of the things that you might not be able to do as someone held within these facilities. But I recommend that you find a way to just maintain the physical distance from individuals at all times. I don't want to really take up much of your time, but I really appreciate you standing here and receiving some of the words that I had to offer. Thank you.